Hello and welcome to Speaking of Health, a place where you can learn how to live a longer and healthier life. I'm your host, Jason Howland, and November is American Diabetes Month, raising awareness of this disease that affects millions of Americans. And with us today is Dr. Shamsul Hasan. He's a board-certified internal medicine specialist at Fairmont Medical Center, part of Mayo Health System, and Roger Sanders, who is diabetic and one of Dr. Hasan's patients. Thank you both for joining us today on Speaking of Health.
Thanks for having us.
Yep. Well, as I mentioned, November is American Diabetes Month, and Dr. Hasan, diabetes affects so many lives in this country, doesn't it?
It does. The incidence and prevalence are increasing, and about 24 million Americans have diabetes, which is about 8% of the population. Roughly 1 in every 14 Americans have diabetes mellitus, and 57 million people may have prediabetes.
And what exactly is prediabetes?
Prediabetes means that the blood glucose level is high, but not to the level of diabetes. So people who have prediabetes have increased risk of developing diabetes over time if their risk factors are not controlled.
Well, let's start with the basics. What exactly is diabetes?
Diabetes is basically a problem of handling the blood sugar. What happens, there is a gland at the back of the stomach which is called pancreas. It does not make enough insulin for the body, so the body cannot utilize the blood sugar, so it starts to build up in the blood.
And blood sugar, where does it come from? Does it come from what you eat?
Yes, it's basically from what you eat, and the body's liver also makes glucose from protein and other sources too.
Well, I've heard of type 1 and type 2 diabetes. What's the difference between the two?
In type 1, the body's pancreas does not make enough insulin. But in type 2, what happens is that initially the pancreas makes enough insulin, but the insulin does not work for the body, or the body's tissues are resistant to the insulin. Over time, the pancreas's function declines, and the pancreas doesn't make enough insulin anymore. So it's a problem of insulin deficiency and also insulin resistance at the end for type 2.
So what are some of the symptoms for type 1 and type 2 diabetes? Are they the same?
Pretty much the same. If somebody has diabetes, the symptoms would be increased thirst, the patient may feel hungry, there would be weight loss, there would be undue fatigue or tiredness, there would be delayed or slow wound healing, and it can present with some medical emergency too.
Roger, tell us a little bit about your story. How long ago were you diagnosed with diabetes?
It's been 20 years since I was diagnosed with diabetes.
And how did that happen?
I was tired and drank a lot of water and stuff, felt thirsty all the time, and decided I better go have a checkup, and went to the doctor, and after they did the physical, and they said that I had diabetes, and that was where we found out that. So
what did you think at the time?
I was a little bit nervous, wondering what I was going to do, or how I was going to take care of things, and I mean, it's something different. You got to do different things and so forth.
So how has your life changed since that diagnosis 20 years ago?
You have to watch your diet, your your carbohydrates, what you eat, and that type of thing, and you have to check your blood sugar regularly and make sure that your blood sugar is under control and that type of thing. So
you say you have to watch what you eat. So what did you eat before that diagnosis, and now what do you eat now? What's the difference?
Well, I mean, I ate a lot of different things, like probably a lot of bread and potatoes and things like that, where now you have to watch that. You can eat some, but not as much as you did before, and that type of thing. So I eat a lot more chicken and stuff like that than I used to, but it's just a different way to do things. So
how about sweets? Are you limited on the amount of sweets you can?
I very seldom have sweets, so I used to eat quite a bit of candy before I found out I had it, and now I limit myself to have to watch, and you can have a sweet, but then you got to get rid of something else. So
So how do you feel?
I feel good. So I haven't had any problems so far. So.
And you said you monitor your blood sugar often. So how often do you do it, and how do you monitor it?
I usually check it 2 to 3 times a day with a meter. You poke your finger, and the blood comes out, and you put the meter on there and see what the reading is, and then you go by that and keep track of that way. So. And
you've had to do that for 20 years now.
Yes.
So it's a part of your everyday life now.
Yes, that's correct. Yep.
So do you also have to get insulin shots?
Yes, I do take insulin once a day. I've been on that for about 5 years now. I also take pills twice a day, in the morning and in the evening. I don't take insulin. I'm not on full insulin. I'm just on once a day shots. So.
And do those help as well?
Yes. Yep.
So what exactly is insulin, Dr. Hasan?
Insulin is a hormone that's made by the pancreas. That's the gland at the back of the stomach. It's basically a protein, and it helps the body to utilize the blood sugar, and it helps the tissues to use the glucose for energy production.
And why do diabetics have to take it as a shot? Why can't you just make an insulin pill that you can take?
It's made up of it's protein. So if somebody takes insulin as a pill or as a solution, the stomach juice will digest it, so it wouldn't be available for the body to use.
So why do diabetics have to check their blood sugar so often? We hear Roger, twice a day he monitors his blood sugar. Why do they have to do that so often, and what are some of the other tests besides that too?
Diabetic patients who take pills only, it's okay if somebody checks the blood glucose once a day. But if somebody is on insulin, it should preferably be checked about 3 to 4 times daily, depending where the blood glucose level is. And the other tests that are available would be fasting blood glucose, hemoglobin A1C, that's a number that reflects how the blood glucose control has been in the last 3 months, and fasting lipid panel or cholesterol check, urine check to see if there is any protein leaking into the urine due to the damage to the kidneys.
And the fasting test that you're talking about, that means they cannot eat or drink anything beforehand, or how does that work?
Yeah, it should be an overnight fasting. Like the last meal should be around like 10 o'clock in the evening, and then you can have your blood glucose or cholesterol checked the next day about 8 or 9 o'clock in the morning.
And why do they have to fast?
So that it gives us a better estimate as to where the diabetes is and whether you have a cholesterol problem in the body.
So if diabetics don't keep their blood sugar in check, they don't monitor it regularly enough and keep track of that, what are some of the complications that can happen?
If diabetes is not well controlled, there could be some immediate complications such as diabetic ketoacidosis or hyperosmolar syndrome. That is a medical emergency. Long term, it can cause damage to the nerves and arteries of the body. It can damage the eyes. It can cause damage to the arteries of the heart, causing heart attack, or can cause damage to the arteries of the brain, causing stroke, or it can cause damage to the arteries of the leg, leading to ischemia and gangrene that may lead to an amputation. Of course, it can also damage the kidneys to the point that somebody may require dialysis.
So there are long-term complications and there are immediate complications that can happen.
Absolutely.
And I've heard of diabetic shock. What is that?
It probably means the diabetic ketoacidosis. Probably that's what it is meant. Diabetic patients may have very high blood glucose level in the range of 400 to 500 to 600, leading to dehydration, and these patients may need to be in the ICU for intensive treatment by intravenous insulin.
You talked about nerve damage. I've heard with diabetics that some of the extremities, especially the feet, can suffer damage. Why is that?
What happens when the diabetes damages the nerves and the arteries of the legs, there is poor circulation in the legs. That's number one risk factor. Number two is that they are prone to injure their legs more often because they cannot perceive the painful stimuli. So if there is an injury, they did never know it, and it gets infected, and it may lead to infection and gangrene, and that's how the leg may, get to a gangrenous situation leading to amputation.
And Roger, you had an example of this somewhat in a little bit smaller term, but an example of complication with your feet, right?
Yes, I have had, and I've had leg bypass, and I had an ulcerated sore on the side of my foot that took about 8 months to heal up. And I've had leg bypass in both legs to get the blood flow and stuff like that going down, working better. So.
And did that help?
Yeah, it has helped, yes. Yep. So.
Dr. Hasan, what are some of the risk factors for diabetes?
If somebody is overweight, if somebody is about 45 years of age, if somebody has a family history of diabetes, such as among the siblings or parents, and some ethnic backgrounds such as African American, Hispanic American, Asian American, Native American, or Pacific Islander heritage could lead to diabetes too.
Does it affect men more than women, or women more than men, or is it equal?
I'm not sure about any exact gender data about it, but it can affect both men and women equally.
And what about treatment? Is there a certain one-size-fits-all type of treatment for diabetes that works best, or does it depend on the patient?
It's very individualized, but the basic the ways of treatment would be pills that can stimulate the pancreas to make more insulin, or it also could be due to replacement of insulin, such as long-acting or short-acting insulin, or there is a new class of medications called incretin mimetics. So there are different treatment for different people.
So a patient comes to you, Dr. Hasan, and says, I've been really thirsty lately, I've had to go to the bathroom a lot more, I've been tired a lot. So what's the first thing you do? How do you test?
If the clinical diagnosis, by listening to what the patient is telling, is diabetes, we would check blood glucose level. If it's fasting or if it's after meal, that's not a problem. Then we should also check a hemoglobin A1C. And if these numbers come back as positive, consistent with diabetes, then we should also go for checking other comorbidities, which would be cholesterol check, a kidney function check, etc.
And at that point, if they are diagnosed with diabetes, their life is going to change, right?
Yes, it is going to change because the diet has to be changed, the patient's lifestyle has to be changed, and the patient has to really take medications regularly and have to follow up with their provider on a regular basis for monitoring of the diabetes control.
And Roger, you know that firsthand. Your life does change.
Yes, it does. That changes quite a bit, yes.
And so how much different is it now than it was 20 years ago when you were first diagnosed? And it's probably more normal to you now, the routine of monitoring your blood sugar and the diet.
Right, yeah. I know what I should eat and what I shouldn't eat and that type of thing. So it's a lot different than it was before where, we go out to eat and we eat, I mean, it's just changed a lot. So
Dr. Hasan, how about prevention? Is there a way to totally prevent diabetes from happening to you?
It may not be 100% preventable if there are other risk factors, such as a genetic basis for the disease. But at least if somebody exercises regularly, controls the weight, controls the diet, it can help to prevent the onset of diabetes.
So living a healthy lifestyle definitely helps.
Absolutely.
All right. Well, unfortunately, that's all the time we have. But we want to thanks for joining us today on Speaking of Health, Roger Sanders, our guest, and Dr. Shamsul Hasan, who's an internal medicine specialist at Fairmont Medical Center, part of Mayo Health System. Thank you both for joining us.
Thank you very much.
And to make an appointment with Dr. Hasan, you can call 507-238-8527. Thanks for joining us on Speaking of Health. Have a great day and be healthy.